June is Men's Health Awareness Month, and one of the things that men should really be thinking about this time of year is their vascular health.
We're here at the Minimally Invasive Vascular Center. This center was built in 2018, the only one of its kind. Okay, there's not one that's an outpatient, unaffiliated with a hospital, a certified vascular center like this in the United States and many other countries as well.
Dr. Jeffrey Dormu is the founder, chief executive officer, and lead vascular surgeon at Minimally Invasive Vascular Center.
This is a model for a lot of other centers that are coming up now. This is a way that you can get your, see a subsurgical specialty, get evaluated, and get treated without having to go through the rigors of the hospitals.
This Men's Health Month, Dr. Dormu is calling men to action, asking them to take their vascular health seriously and be more proactive.
We tend to avoid doctors in general, especially men. Men specifically, and African American men, they run. They run the opposite way. And this is Men's Health Month, and we need to talk about men and the problems we have. We need to talk about erectile dysfunction. This is something that in some households, even in some relationships and marriage, is considered taboo. Men, this is something that we should not be ashamed of. There's over 45% of men over the age of 50 who suffer some degree of erectile dysfunction. The beautiful thing is it can be treated minimally invasively, and even more importantly, it can be properly diagnosed. Many times when we go to the urologist or a men's clinic, we're just getting treatment and we're not understanding why we're having this problem. Here at the Minimally Invasive Vascular Center, we can give you a prompt diagnosis and find out what is the cause. Sometimes it's one cause, sometimes it's many, but we can narrow it down and then we can put you on the right treatment path and take care of that erectile dysfunction problem.
Beyond ED, vascular disease and cardiovascular disease are more pressing, life-threatening issues.
Vascular disease, also coupled with cardiovascular disease, is the #1 killer in America. It kills millions of people every year. The different risk factors that are involved in vascular and cardiovascular disease is smoking, which is the #1, diabetes, high blood pressure, high cholesterol, obesity, and also being over the age of 50.
Common conditions include?
We've heard of lymphedema, where we see people with increased swelling of the legs, discoloration of the legs. Sometimes they actually look like tree trunks. PAD, which older populations call hardening of the arteries, is usually the common issue when it comes to the arterial circulation. And when it comes to veins, usually you have either leaking of the veins, what we call reflux disease, or a DVT, which is a clot that can lead to vascular devastation by breaking loose and going to your lungs.
That is why it is critical that men address any symptoms they are having early. Correcting them and getting back to a healthy state of being doesn't have to be scary, especially here at Minimally Invasive Vascular Center.
You don't want to wait till this vascular devastation happens, meaning stroke, erectile dysfunction, heart attack, kidney failure, or the loss of a limb.
Dr. Dormu says up to 97% of cases never have to see open surgery, which used to be one of the only options for many.
We can go in without having to cut a patient, opposed to open surgery, which was pretty much the norm. It was very common, especially 5-10 years ago, and still is in some institutions. But here at the Minimally Invasive Vascular Center, we pride ourselves in fixing the circulation from head to toe without having to cut patients at all. We know that that helps in their recovery time, it helps in their quality of life, and people in general are just afraid of surgery. They can get by with minimally invasive surgery, needle puncture stick without having to be cut, without having to worry about an amputation, and they walk in and within hours they walk out and pretty much heal within a matter of hours.
We'll be right back with more Midday Maryland right after this. Stay tuned.